Good morning. I'm going to unmask to speak because you probably couldn't hear me behind it. So first and foremost, thank y'all for coming out today. I think this is a great day for Cobb County Sheriff's Office, not only for the Sheriff's Office, I like to say for the state of Georgia. It's always good to be the first at doing something. And I think this first is really, really needed. This is something when I ran for office that I thought about briefly, but after I got in office and had some conversations with State Representative Wilkerson, really made my mind start pushing forward and seeing how can we bring this to Cobb County. So Cobb County will be the first sheriff's office in the state that will provide 24-hour mental health care. And I think that is just awesome. With over 70% of our individuals in our facility having mental health issues, what better way for us to capture that and get them the help they need while they're here by having services that's going to be for 24 hours. And first and foremost, let me do this as well. Thank all the elected officials that's here today for coming. I see several of you all out in this audience today, as well as thank my staff from the Sheriff's Office who's here, the county managers here. There's several police chiefs here as well. Thank you all for coming as well. And these chiefs are who we support here, and we're taking a lot of the inmates they bring to our facility to hold here. So thank y'all again for coming, and thank y'all for the continued support to Cobb Sheriff's Office. This is a team effort. With me having conversations with our state representatives about this program, our community leaders, we knew it was a needed program. And our county managers and our county commissioners was in agreement this is something we really need to do for the citizens of Cobb County. And hope this model program we're using here in Cobb County can be used throughout the state of Georgia. And we felt the expense that it's cost is worthwhile taking care of our citizens here in Cobb County. So as we always say, once they come through those doors, they're under my custody, care, and control. So they are my responsibility. So it's my responsibility to take care of them once they get here. So I think by having this program, that is exactly what we're going to do. What I have behind me today is my Assistant Chief, Michael Register, and I have my jail commander, Mr. Pete Atkins as well, Colonel Atkinson, rather, is here as well. So these two individuals are very instrumental in this program as well as my Chief Deputy, who had to attend another event the morning and couldn't come today. So with that being said, I'm going to turn it back over to Ms. Sabalone, who's running the program today, and we're going to get some more important people other than me to speak to y'all and tell you a little bit more about the program. Thank you.
Well, good morning, everyone. Here's your mask. Thank you.
Yes, sir.
Thank you. My name is Rob Leonard. I'm the Chief Judge in Superior Court, and thank you for the invitation to appear here. I don't think it's really a surprise, probably to anybody in this room, that our jails, for a number of different reasons, have become the largest providers of mental health services really around. And so it's not an ideal situation, and it's not one created by any sheriff in this state, but it is one that our sheriff's going to have to deal with, and I'm glad that our sheriff's dealing with it on a proactive level here in Cobb. So there are a number of downstream benefits that I think that this county will receive from this program, and specifically that the court will get from it. Number one, I think it's going to position people to be better situated when they arrive at court. Right now, most of the time, I don't even know that there's a mental health issue until the case is already on my active calendar. And so when it's brought up at that late stage in the game, it can cause months of delay before we can get someone evaluated and take whatever steps might be necessary for that. So I think that's going to be a big plus, is if there's a sharing of information, be it through a release or whatever. I was talking with the Vice President of WellPath back there earlier. We believe there's some partnerships to be created that will help us move those cases and cut down on some of that delay. Number two, I think it's going to increase everybody's likelihood for success. At some point, these folks are going to get out of jail. They're either getting out on bond, they're getting out on probation, or they're getting out in one of our accountability courts, and it's going to increase their likelihood of success. Early diagnosis and treatment of those underlying mental health conditions, I think will do a big service to them and help them as they move forward. Lastly, as I mentioned a minute ago, in the idea of some partnerships, I think early identification of potential people to go into our accountability courts, if we can work on that, I think that's a big plus. We've got several different accountability courts that I think will dovetail nicely with this, including our mental health court, which has been recognized as a model court for the state of Georgia, as is our veterans court and our drug treatment court. So our accountability court judges stand ready to step in and get our teams ready to staff those cases up once those are identified at an earlier stage. So thank you all for having me here. Those are the benefits I think we'll see. Thank you, Sheriff.
Thank you.
Good morning, everyone. I'm Dr. Jackie Mcmorris, Cobbs County Manager. Thank you, Sheriff, for the invitation. I can't echo any more than the Sheriff, our Judge, and others who will speak after me how important this is to our community. I can't speak on behalf of the courts, I can't speak on behalf of the jail, but I can speak on behalf of the citizens of Cobb who follow our slogan as expect the best, to expect the best in Cobb, regardless of who you are in your circumstance. Mental health affects all of us in some way or the other. It stigmatizes our community, and we can do better. And this program allows us the opportunity to address it and to do better, to be better. There are family members who are impacted by their loved ones who have been diagnosed or misdiagnosed with mental health issues. So for that, I say on behalf of our chair and the Board of Commissioners, we support this program, Sheriff. We support you. We support all of our law enforcement. But more importantly, we want to be the leader in the state. We want to be the leader in the region for doing better and being better. And for that, you have our total support with this program, and we look forward to making sure that this program will make a true difference in the lives of those that is implemented, once it's implemented, it will help them once they leave and hopefully reduce recidivism. So thank you so much for what you do. Thank you to the community WebPath for all that you're doing as well.
Good morning. I'm State Representative David Wilkerson, and I just want to say, being in Cobb, it makes me awful darn proud to work with the sheriff. And it was about a year ago, I was outside, and we were talking about some of the unfortunate deaths that had happened in the jail. And that's happening all across the state. It's not just in one isolated place. And someone said, "What are you going to do about it?" And I looked at them and I said, "We're going to get right on it." And at that point, we started looking at some of the changes we could possibly make. We looked across the country. One of them was, whenever there's a death, investigate it outside the jail, have the GBI brought in. And we try to do that statewide. 24/7 mental health services. Sheriff Owens didn't wait for a law to be passed at the state level. He immediately instituted investigating all deaths. And that helps here, and it helps the public have the confidence that things are being done the right way. Always having that independent look. So I just want to say, like I said, as an elected official, there are things you can move, and sometimes down to the Capitol, things move slowly. And Terry Norris with the Sheriff's Association has been great about talking about some of the challenges they face across the state. You have people working in our jails that may not make as much as you think they do, and they're dealing with some tough situations. So this is going to provide them the tools that they need, because they can't do both. They can't be a mental health professional and do their job. This will give them those tools. And so I just want to say, hopefully we'll be able to take this, and the legislature will kick in some money. I'm going to be having some talks with the leadership down at the Capitol that not every county is as blessed as Cobb County, and that we need to do this across the other 158 counties there are across the state of Georgia. And I'll make that commitment that I work with people on both sides of the aisle, because mental health is one of the #1 challenges we're facing, especially with the pandemic. So I just want to say thank you again. Thank you to everybody here. Thank you all for your service. And thank you for the community for actually caring about this issue, because as Dr. Mcmorris said, it doesn't just impact the people that are here. It impacts their families. It impacts their brothers, their sisters, their parents. It impacts children. This is a generational issue. You have one generation. That means that the person can't go to work. They can't do their job because they're worried about their family members. So I could go on and on, as you can tell. This is something I'm very passionate about, but I just want to say thank you and for everything we're doing, and look forward to doing some better things in the future, even more so.
Now we'll hear from the representatives from WellPath.
Good morning. Thank you. I appreciate the opportunity to be here. First thing I want to say is I'm so proud to be partnering with Sheriff Owens. You are taking a very important, innovative step in dealing with this very challenging issue. We serve some 300 agencies around the country, and mental health is the biggest issue in all of them. Our job is to take care of a very vulnerable population in very challenging clinical environments. It's work we do. And we see it from the ground. We understand the challenges. And in some places around the country, people are beginning to very important work. This is at the top of that list. So you're to be commended for this. Thank you for making this important decision. I do want to say that the most important people to me in this room are the folks back there who are going to be doing this important work. So I had a chance to meet our health service administrator, director of nursing, mental health coordinator, and all of the very important people who are actually going to do this work. So thank you for what you're doing. You are the most important people in this room. You're taking care of a very important population. We thank you for that, and thank you, Sheriff Owens, for what you're doing. Appreciate it. Zella?
Hi, I'm the Group Vice President for Partnership Development for the East, and I do want to follow in the steps of our president. There's a lot of great work that we're going to be doing here, and we're going to be doing it as a collaboration. Sheriff, thank you for allowing us the opportunity to do this together with you and your communities. We have a lot of people in this room that are all wanting to accomplish the same goal, and that is to provide the best care for those who need it most, both for chronic and acute illnesses. And I just want to say we're very proud of this moment and just being able to do this together. Thank you all for the collaboration, and thank you, team, for helping us accomplish this together. So we're going to call up our team to talk a little bit about our program and what we plan to accomplish here in Cobb County. Greg?
Thank you. I'm Greg Smith, the Vice President of Mental Health for WellPath. Recurring theme, Sheriff Owens, thank you for your investment in mental health. Our jails across this country have become surrogate psychiatric hospitals. The needs are absolutely immense, and the needs are absolutely not shrinking. It's my privilege to introduce Donna Carter, who's the Regional Director of Mental Health. This site is in her backyard. She's going to be kind of the main clinician, and she's going to talk a little bit about kind of what some of our programming is going to be for WellPath going forward.
Good morning, everyone. And again, Sheriff, thank you so much for allowing us to be able to care for our patients. As you have heard, that jails are now the new psychiatric hospital, so having a lot of patients here. We have now a clinical team of licensed clinicians that will be providing the care for those patients. So the ability to diagnose and treat those patients and with best practices. We also have a full-time discharge planner that will be working along with the team to kind of make sure those patients are getting handed back into the community appropriately and connected to care, working with our court systems and making sure that, again, they're getting the proper care not only while they're here, but able to connect when they're in the community. We also have a full-time psychiatric team, so we have 3 psychiatric providers that will be here full-time, 7 days a week, that will be able to provide care for our patients as well to make sure that they're getting the type of not only diagnosing and treating, but medication management or whatever assistance they may need from a team of medical providers to be able to care for them. We will also be using best evidence practice programming while their patients are here. So our team of people that are sitting on the back row that everyone has spoken about, that will be working with them on a day-to-day basis to make sure that they're not just here and being getting an assessment, but they will be getting daily treatment. They will be getting treatment from our clinicians and seeing accordingly. They will have treatment plans that they will be working with them with to make sure that every patient is getting the care that is needed based on their need and their individual assessments. And we have to our psychiatrist, Dr. Cobb, as well.
And now we'd like to open it up for questions. If anyone has any questions, if we could have our team come up and join us.
Is the focus of this program going to be more on crisis management and whoever goes against you? More on crisis management or more on ongoing care for patients with sort of low-grade mental health issues?
It's going to be a combination of all of that. So we will definitely be focusing on crisis management, but we will also be providing care for our special needs populations, those with chronic mental illness, and just those that are out in the general population that may just need assistance or need support of some kind. We will be providing all of it.
How will this program help address repeat offenders and reduce crime overall?
As far as addressing repeat offenders.
Yeah, well, we're hoping this program will limit some of those repeat offenders by getting the correct help they need, which they haven't gotten before. So sometimes offenders that are repeat offenders never really get the correct treatment so they can be, for lack of better terms, good when they go back out. So hopefully we can fix some of those issues and continue that care when they go. As she said, we have a discharge planner now, which also refer them to treatment as they leave our facility with other local services so they can continue that treatment so they hopefully stay on the right track and hopefully keep them from returning.
And as you know, patients don't generally get better without treatment. So we're going to provide treatment for them while they're here. Hopefully, when they get back in the community, they'll be in a better state.
In terms of the nuts and bolts of covering those 24 hours, how is that being, you say there's a staff of 3 that'll be assigned to the ADC. In other words, is the psychiatrist going to be there during the day and psychiatric nurses? I'm just wondering about how, in a practical sense, if something arises at 2 a.m., what happens?
So yes, we will have a chief psychiatrist that will be here during the day, as well as 2 mid-level providers. But we also have on-call. So like you said, if something happens at 3 in the morning, we have a psychiatrist that will be taking on-call that will be able to provide the guidance for that.
Yes, and we all, as you heard, we do have clinicians around the clock as well. So there will be 24/7 coverage, and our program will make sure that we focus on the treatments that are provided and making sure that we provide stabilization as well as continuation of services needed for our patients.
So I know this is the first program like this in the state, but are there any models in other parts of the country or even the world that y'all are sort of looking to? Or do y'all have any experience working in incarceration facilities elsewhere?
Yes, hi, Kip Hallman, president again. Yeah, we work with hundreds of facilities around the country, and as I said, a handful are doing very innovative work. We have programs where we have crisis intervention programs. We have programs where we have diversion programs. We also operate a number of psychiatric hospitals, and of course that work is very much focused on this kind of population. So we do have places where we have 24/7 coverage in a psychiatric facility. So we do see examples out there.
And we actually have used all of those methods to come up with the best program here for Cobb County. So we've taken all of our experience, combined it to provide excellent care here in Cobb County.
I just want to add something to that I think is important. I think they're taking a lot of best business practices from the United States, from the other institutions they worked at, and now we're creating something different and special for Cobb County. So this is a unique program. Of course, as you know, it's going to be the first in the state. So it is unique, and it's nothing. We don't have a lot of the programs to go by. But based off what they've done in other institutions, we created something specific for Cobb County. And as our county manager said, she's like, when you go to Cobb, expect the best. We had to come up with something different to stand out, and hopefully to make Cobb be the best and be the model that everyone else wants to follow in the state and across the nation. So now we're creating a program that's going to be unique for Cobb, because we've got unique citizens here in Cobb. So we got to give them the best treatment, so that's why they create this special program for us to go forth with.
If I could just go back to the discharge planning question, there's discharge planning and there's rigorous discharge planning. So our discharge planner is going to be building a lot of relationships in the community and doing everything they can to set our patients up for success once they're released. That is incredibly important. It's often very frustrating sometimes where jail can stabilise a patient and we can get them looking great, but yet when they get out in the community, there's no soft landing. Our job is to help create as many soft landings for our patients when they get discharged. Thank you.
Any other questions?
Yes. Was there a certain event that prompted this program to begin? And does this have anything to do with the homeless population?
Sure.
That's a good question. Is it one certain event? Not one certain event. Actually, there were several things as I ran for office where I saw we were having issues in the facility before I took office. I knew, and once I got in office, actually, our mental health problem, it was a problem. And what could I do to fix it? And I didn't have a good answer. And then one day we're having a conversation with Representative Wilkerson, and he said, he's talking, we need some mental health care 24 hours. One of our community activists, Ms. Sally Riddle, brought up as well, what are we going to do to solve our mental health issues? So those things were on my mind as I was running for office. And it just so happened I was able to find a company who was willing to put this into action and build this specific plan for us based off some conversations with Ms. Riddle, State Rep. Wilkerson, and this all came together. So nothing one particular thing, it was a combination of things which we knew we had to effectively tackle. I want to do it in this first term, or at least in my first year, at least get this program up and running, because that's just how important I thought it was. And specifically to our community activists who there's a lot, lack of better terms, were on me about this from the beginning. Before I got elected, and once I did win, they was always on it. What you gonna do about mental health care? What you gonna do about mental health care? So I knew I really had to do something. But when I wanted to do something, I wanted to make sure it was big. And I want to be big, and I want to be great, and I want to be something that's going to set the standard for the state, and even, maybe even for the nation going forward, how we can aggressively attack our mental health issues here in Cobb County.
And Sheriff, we heard Representative Wilkerson reference the inmate that's here from a couple years ago. Do you feel this program will make detainees and deputies safer inside your jail?
I surely hope so. That's the goal. And it's also to prevent, hopefully, happening of the death. I'll be remiss if I say that may never happen, but we're going to do everything we can to make sure it doesn't happen, by providing the best care we possibly can and increasing our deputies inside our facility as well. Our jail commander may have something to add because he can tell you how it's going to increase our safety.
Thank you, Sheriff. One important thing is a group that nobody has spoke about, and that's the men and women of the Cobb County Sheriff's Office that work in this jail each and every day. They were screaming for this type of program. Can you imagine how frustrating it is to have someone that you can't help? You know, we attack it from a security standpoint, but probably don't, and really we don't have the ability to attack it from a clinical standpoint. Now the sheriff and WellPath is giving us the tools in order to help those persons that really need that help. So I stand here today to say that this was a grand step for our employees because they were desperate to have something like this, and it's going to do wonders, I guarantee you. Thank you.
Any more questions? If not, we'll go outside for the ribbon cutting.
I think you have
One more. Judge Leonard mentioned the dovetailing with the accountability courts. Are there going to be formal procedures in place to refer people to the accountability courts that are appropriate to the program? Have y'all worked on that at all?
We've not fully developed it, but it is in consideration, and so we will definitely be connecting with the accountability courts. We will definitely be referring through attorneys, through the patient care, to the accountability court. But as far as the fine details, we don't have that for you right this minute.
In regards to connecting them with the accountability courts, we already currently do that. What this is going to allow us to do that is to do it at a larger scale. So as the sheriff and the county manager said, we're the best. So, being at that level wasn't good enough for us. We're going to take it to another level.
And if I just may add, there's a lot of reporting that comes with us. There's a lot of process and procedures. So we will be focusing on making sure that there's transparent communication as well with the community as to the treatment that's being provided for our patients and the solutions that are being provided in our communities. So thank you so much.
All right, here we go. All right.